Hello, my name is Nurse Pauline RN. Welcome to my channel. Today we will be talking about exam number 4. This channel is not a financial aid channel. The goal of this channel is to assist nursing students to be successful in their fundamentals of nursing exam and NCLEX examination. I uploaded 49 chapters of fundamentals of nursing, starting consecutively from chapter 1, chapter 2, chapter 3, all the way through to 49 great chapters. Please read them before you do your examinations. Before I get started, please hit the thumbs up button. Please subscribe to this channel if you have not subscribed. Please share this channel to your friends and families, even if they are not nursing students. Please share this channel. Included in my examinations and in my chapters are clinical procedures. Please review. Thank you. I'm going to start with documentation. When nurses are charting their assessment, it's done by CBE, charting by exemption. Charting by exemption reduces time spent in documentation. It is a shorthand method of documenting. If a doctor is looking in the patient's chart for assessment and is trying to find a narrative, descriptive form of documentation of assessment, he will not find it. We do not do narrative descriptions. We chart by exemptions, which is a shorthand method of documentation. We have to dispose of any printed materials on the patients in your threading machine. We do not throw them in the trash cans. A timed get up and go test allows the nurse to assess the risk of patients falling. In a timed get up and go test, the nurse can assess for unsteadiness in your patient's gait. Patients who are at risk for accidental hypothermia are the homeless and the very old. For pediatrics, car seat directions are toddlers must reach age 2 and height for weight requirements before they can ride forward facing. Factors that put elderly at risk for falls: inadequate lighting, throw rugs, multiple medications, doorway thresholds, throw rugs, cords covered by carpets. Steps for applying restraints. Identify your patients. You do your 2 identifiers, introduce yourself. Be sure that your patient is comfortable in the arm you're going to apply the restraint in. Make sure the arm is aligned. Assess the condition of the skin of the arm that you're going to apply the restraint in. Wrap the restraint with the soft part of the restraint towards the skin and secure snugly. If a family member is leaving the patient for the night, saying goodbye, and ask you, "Nurse, my mom seems a little bit confused," and usually in the night she gets confused, "Can you put the 4 side rails up?" 4 side rails are considered a restraint. We do not put 4 side rails up. Before requesting an order for restraints, we could ask the family, if present, to stay with the patient. Inform the family the risk associated with using 4 side rails. With 4 side rails, patients, elderly, confused. They usually get up, try to climb over the 4 rails in between the rails, and that's at risk for falling, fractures. So you discuss the risk. Discuss alternatives that are appropriate to this patient and family. Then, if the family isn't able to stay with the patient, you communicate with the doctor that you need soft restraint for your patient. Safe driving for the elderly. Encourage your patients. Teach, drive shorter distances, drive only during the daylight, use side rear view mirrors, look behind towards the blind spots. Initial nursing intervention for confused elderly patients with anxiety. Place your bed alarm on. When you're evaluating your patients for wrist restraints, check your patient's peripheral pulse. Patients with restraints, you should toilet them every 2 hours. Offer fluids, prevent dehydration. Release your restraints at least every 2 hours, and check the circulation in your patient's arm. Inspect skin breakdown for under the restraints. Factors that increase risk for patients taking hypertensive medications and diuretic. These risk factors puts the patient at risk for falls. Assess factors that increase risk of falls for patients taking antihypertensives and diuretic medications. Assess history of recent falls. Assess neglect, spatial and perceptual abilities. Assess impulsiveness in your patients. Unsteady gait. Assess for patients who need assistance with walking. Patients at risk for falls. Patient with IV lines while ambulating. Patients who has urinary catheters, ambulating with urinary catheters. In the event of an explosion in your area, the emergency department will notify you. You will prepare yourself for an influx of patients. Protecting patients with seizures. With patient on the floor, clear your surrounding areas. Clear your surrounding areas of furniture or equipment. Keep your patients safe. What's the role of the patients during a fire? Help to evacuate your patients. Shut off medical gases. Use fire extinguishers. Direct ambulatory patients from the area. Let's talk about environmental and psychosocial cues. In a teenager for substance abuse, assess patients for blood spots on clothing, long sleeve shirts in warm weather, changes in relationships, wearing dark glasses indoors. For immobility assessments, we will assess patients with possible pulmonary problems due to impaired mobility. We'll assess our patients for elevated respiration, elevated heart rate, crackles in lower lobes heard on auscultation. For immobility patients on bed rest, the nurse assesses your patients for sign of immobility. Example, patients with decreased peristalsis. For elastic stockings or venodynes, SCD, sequential compression devices, while in bed, these are ordered post-operatively for patients following major surgery. Nurses need to know that elastic stockings, venodynes, sequential compression devices, SCD, promotes venous return, prevents blood clots, prevents pulmonary embolus. Teach your patients way to minimize risk of developing osteoporosis. Swimming 3 times a week. Encourage your patients to have a bone mineral densities test. This is a DEXA scan. This is an X-ray. Patients with fractured hips post-operatively. Encourage your patients to use overhead trapeze for positioning and transferring, getting up and out of bed. Older adults who are bedridden, assess complications of immobility. If patients states that they are complaining for ankle joint stiffness, this is one complication of immobility. If your patient is administered heparin, signs of symptoms of bleeding while on prolonged bed rest is bruising, bleeding gums, coffee ground like vomitus, or all signs and symptoms of bleeding for patients who are on heparin. Patients who are at risk for osteoporosis is required high intake of calcium. Example, broccoli, whole wheat, cheese. Pay attention to your diet. They are given in NCLEX examination. Evaluation of SCD, sequential compression device. These are ordered by the doctor post-operatively. Nurse should assess for inflation pressure of your SCD. Common complication of prolonged bed rest due to immobility is pressure ulcers, bed sore. You turn your patients every 2 hours who are immobile on bed rest. Effect of immobility on cardiac systems. Example includes thrombus formation, increased cardiac workload, orthostatic hypotension. To prevent complications of immobility, first post-operative day of surgery, the nurse will get up her patients first thing in the morning, transfer your patients to the chair. When your patient is well settled in the chair and feels comfortable, you will walk this patient as soon as possible. Prevents blood clots pulmonary embolus. Implication to maintain a patent airway for patients on bed rest is suctioning your patients every 4 hours. Please review your clinical procedures for application of your TED hose. Your stockings prevents blood clots. One thing you need to know, you need to measure the patient's legs for appropriate size of your stocking. Before you apply your TED hose stockings, you will turn it inside out until the heel is reached. Once that heel is reached, then you can slide the remainder of the stockings over the leg and smooth out the wrinkles. Physiological outcomes of immobility is decreased lung expansion. For infection control and prevention, most effective way of controlling transmission of infection is hand hygiene, hand washing. What you need to know about C. diff. C. diff, this organism is usually transmitted through oral fecal route. Hand washing should always be with soap and water. This is a test question. For C. diff patients on contact isolation, you'll wash your hands with running water. After you leave the patient's room, you close the door. The handle of the door is dirty. You will use your hand sanitizer and clean your hands. For MRSA infection, this is also contact isolation. Methicillin resistant Staphylococcus aureus, MRSA. This is contact isolation. After providing care for infective patient leg wound, perform hand washing after care and after handling contaminated equipment, hand washing. For TB patients, N95 mask, airborne isolation. Explain the reason for isolation procedure to your patients and provide meaningful stimulation. Make sure the phone is closed, the television is there. Give them a book to read, provide meaningful stimulation. A nurse wears a mask when suctioning a patient, when assisting with aerosolizing respiratory procedures. The nurse wears a mask for droplet precaution. You can be working with a patient with C. diff. You don't want to get splashes in your eyes or face. You can wear your mask or your goggles. The nurse is assisting a patient. If the nurse is assisting your doctor to insert a central line, you always wear a mask. PPE, personal protective equipment for nurse. For chickenpox, we use PPEs. For herpes patients, these are airborne isolation. We will wear a mask. We will wear disposable gowns. PPE, airborne isolation, N95, TB, airborne isolation, N95. Actions that would contribute to reduce healthcare acquired infection. Teach correct hand washing. Using correct procedures in starting and caring for IV infusion. providing perineal care to patient with an indwelling catheter. This reduces healthcare acquired infections. The principle of sterile surgical asepsis keeps sterile field in view at all times. When you're doing a sterile dressing, do not turn your back on your sterile field. When you're inserting a Foley catheter, that's a sterile procedure. Do not turn your back on your sterile field. Keep it in view at all times. Surgical asepsis, sterile asepsis. Consider the outer 1 inch of the sterile field as contaminated. An indwelling catheter present a risk of urinary tract infection, UTI, indwelling catheter, especially in the elderly. It allows migration of organisms into the bladder. It obstructs normal flushing actions of urine flow. Urinary catheters risk UTI infections. Steps for removals of PPEs, protective barriers, after leaving isolation room. When you're leaving your isolation room, this is the procedure. You will remove your PPEs. Please review in your clinical procedure book. Remove gloves. Remove eyewear and goggles. Untie waist, neck strings of gowns. Remove the gown, rolling into itself without touching contaminated side. Untie top and bottom of mask. Remove mask from face, then you'll wash your hands last. A patient that is diagnosed with MRSA, multi-drug resistant organism in a surgical wound. I'm gonna be coughing. I have to end. Have a good day. Thank you.